Where a news conference is just getting underway regarding the 7-year-old girl who was shot in the back with an arrow.
However, she arrived in our trauma room at 8 o'clock on Sunday evening. And when I first saw Ariana, I would describe her as a 7-year-old bundle of human strength. She was composed, she was calm and quiet. At that time, she was awake. She was able to talk. However, this was painful to her, so she was mostly quiet. And there was some pain with her breathing, although her vital signs at that time remained stable. We evaluated Ariana in our trauma room for about 17 minutes before we went off to the operating room to remove what I believed was an arrow. At my left here, you see a picture from her CT scan, which was obtained in Fond du Lac. This picture shows a lateral view of Ariana with a visible metal tip in the abdomen related to this projectile. Right here. And what you can't see perhaps as clearly is that there's a shaft projecting from that tip back towards the back up in this direction. We recognized immediately the need to remove this in a controlled fashion. The EMS had done a terrific job in securing this arrow, which is exactly the way it should have been handled. And she arrived to us in as much comfort as she could be at the time. When we went to the operating room, I elected to basically cut the arrow flush with the skin. This would allow us to turn her onto her back, and we completed a trauma laparotomy where we identified the following injuries related to the arrow. First, there was penetration of the left chest through the lung, through the diaphragm, through the spleen, through the posterior and anterior walls of the stomach, the front and back of the stomach, and the end of the arrow landed in the left lateral segment of the liver. We were able to, with the excellent help of our crew in the operating room, show every inch of the trajectory of this arrow and to control all of the damage that it inflicted on these organs. This was sequentially just closing the holes in the stomach, placing a drain in the left chest to allow for safe removal of the arrows in case there was air leaking from the lung, closure of the hole in the diaphragm, and controlling of any bleeding from the spleen. I'm happy to say that we were able to preserve all of her organs in her laparotomy. She was in the operating room for about 2.5 hours. Things went well. We had minimal blood loss. And after surgery, she was actually taken to our general surgical ward where she's currently convalescing. This is a team effort, and I want to thank everyone from the EMS. I've been an EMT before. It's not an easy thing to see a projectile like this in a child in the field. They handled it perfectly. The care in Fond du Lac was excellent. I'd like to thank our staff, both in the trauma room and in the operating room, for delivering excellent care and really giving us a good chance at a full recovery for Ariana. Her current condition is fair. We project about a 1 to 2 week stay in the hospital while we wait for her intestines to heal from her operation. She's already been ambulating out of bed, walking, and is talking to us. And she's done quite well. We've had really minimal blood loss through this whole event. And I'll now take any questions that you have for me. I don't expect any long-lasting injuries that will affect her function. There are a few small risks related to a previous operation which anyone would incur who's had an abdominal surgery.
Dr. Densmore, talk about how unusual this type of a surgery was.
Well, we frequently do laparotomies for trauma here at Children's Hospital, usually in penetrating injuries for gunshot wounds. It's very, very rare to have an arrow injury. I've never seen it. It's a different mechanism than what we typically see. However, our experience dealing with other penetrating injuries such as gunshot wounds and stabs allowed us to care for Ariana.
How lucky is she to be alive?
I would say very lucky to be alive. Obviously unlucky to be hit by this arrow. Had we changed the trajectory of that arrow by as little as 2 centimeters, this could have been a very bad outcome.
Laura, what's your response to all of this? If you want to go to
Responses on how? Like
Just
any
how
other
your
mother
daughter
would
doing?
be, seeing their daughter shot by an arrow, basically.
How is Ariana handling this right
Ariana's scared and in a lot of pain. She told us she's mad because she wants to know why this happened to her when she didn't do anything wrong.
What went through your mind when you first heard about this?
I screamed. I seen it. She was on the sidewalk right in front of our house. Screamed loud enough to have neighbors come out of their house to come look what happened.
Have you been able to determine who possibly did this?
No idea. I know there's detectives working on it, but I haven't heard anything.
What would be your message to, if that person happens to see this on the news tonight? I know that investigators are working on the case, but what would you want them to know?
Obviously it wasn't intentional. I mean, that'd be pretty terrible for somebody to try and shoot a 7-year-old, but it was windy out and wherever it came from, it wasn't aimed directly towards her. It was an accident. You're not supposed to shoot a bow in town, but somebody was doing it, and they know they were doing it at the time that all the sirens started going off. And for them not to come say something is ridiculous.
How are the children doing who are with your daughter?
Not good.
You said Ariana was angry, mad, upset. Are you feeling the same way? I mean, what do you think?
It just shouldn't have happened.
What do you have to say to the doctors who performed this surgery on your daughter?
They saved her life.
It's the first time we were seeing what happened with the result of the x-ray and the arrow. That you originally had seen it and you had underestimated how long that arrow was. When you take a look at that x-ray, what goes through your mind and how do you describe it? You're taking a look at there.
She's lucky it wasn't worse.
Did this
She could have
happen
been
right-
a step back and it could have been in her head.
Did this happen right in front of your house?
Yeah.
Were you,
I didn't see it actually happen. I heard her scream and turned and looked, and I seen it.
Is your daughter up around talking right now? How does it feel to see her doing that?
Well, she's not back to her normal self by far, but it's hard to talk with her. She's being very quiet. She doesn't like getting up. It hurts.
Doctor, you had mentioned that when you saw the arrow, it was still in its full form. If you could, over there, was not removing the arrow, which would be a panicked response by someone in the field, something that you think ultimately played a role in her condition not being a whole lot worse?
Absolutely. I can tell you that being in that position in my prior years, that the reflex that you have to overcome is to remove the arrow. You do not want to do that. They followed the trauma and life support guidelines perfectly to a T and left that in place and stabilized it. When I saw the arrow, it had been shortened for purposes of transport, but was stabilized and visible.
So both mom as well as the initial first responders did everything that they were supposed to?
Dr.
Absolutely.
Densmore, how does her age complicate the process or recovery, or how does that affect it?
In terms of recovery, low age is usually a huge benefit, and I had the fortune of operating on primarily children. So we expect a faster recovery for Ariana than from an adult who would sustain the same injury.
Laura, does Ariana completely understand what's happened to her? Does she know?
She doesn't understand why it happened. She knows that it was an arrow and that it hit her in her back. I don't know if she knows to the extent of how far it went in.
The nature of the arrow tip it may be of some interest. The arrow tip appeared to be a field point, a non-cutting type tip, typically used for target practice.
I guess just any sort of a message as a mother, just to your daughter, to her sister and the friend that saw this incident happen.
2 of her sisters and a friend. they're lucky they screamed as loud as they did, that it got our attention. To Ariana, she's super brave.
What does it mean for you to, you heard the doctor describe her as a 7-year-old bundle of strength and,
You gotta know Ariana, she's a little spitfire. She is strong.
Doctor, just as a kind of a wrap-up here, out of curiosity, how many surgeries has she gone through, and if you could kind of let us know how many organs were damaged by the initial puncture?
She's had one operation.
Dr. John Densmore just wrapping up a news conference on the surgery that he performed on little Ariana Sheenberg, indicating that the arrow that hit her in the back penetrated her lung, diaphragm, spleen, stomach, and liver, and that she is very lucky to be alive. And if this had been just 2 centimeters in one direction or the other, the outcome could have been tragic.
Yes, and she is in fair condition, and she will spend about 2 weeks, 1.5 to 2 weeks in the hospital, but she's been walking, doing well, and has had minimal blood loss. And one of the interesting things at this news conference we've heard is how well the EMT responded, that they did a perfect job in making sure that little Ariana was able to survive.
And this is Ariana's mother, Lauren. She has been through so much, handling herself very well under very difficult circumstances.
We'll take a quick break and we'll be right back.